Hello, welcome back. I'm Dr. Ariani from Holistic Dental Healing Program. About 100 million amalgam fillings placed every year in the United States. Amalgam filling is filling that place inside the tooth that has a blackish or a silvery color. It is cheaper to place. It is durable. It's been around since 1800, and believe it or not, it started by barbers. Barbers long time ago are not only the one that cut the hair and the mustache and all that, but also they do extractions, and then they discover that mixing several metals, i.e., tin, silver, copper, and nickel, together with the mercury, can create something that pliable, feeling that pliable and easier to place and last long. So it's much easier for the barber to do the filling other than to do the extraction. And that's how amalgam filling is being integrated to dentistry until today. Even though amalgam filling has all of those benefits, there are several drawbacks on this, such as aesthetically is unpleasing for a lot of people. When dentists place it, they need to remove some more healthy tooth structure, so that can weaken up the tooth to create retention on the filling itself. And along the time, because this is metal, it contracts and expands, and the contraction and expansion of this metal finally can cause crack and fractures of the teeth and the filling itself. For people who has allergies to metals, this also can be source of irritation for the gum, and then can cause gum irritation or gingivitis, and can go all the way to periodontitis, which is the irritation or inflammation in the bone surrounding the teeth. So a lot of countries in Europe already ban amalgam filling because of that. Research also has shown that this amalgam filling is not as stable as we thought it used to be, because as you chewing, brushing your teeth, clenching, grinding, and also some people, they love to chew on gum. Those activities can release vapor, of course in the micro dosage, but if it happens day in and day out, it can accumulate in the body, and it takes long time to release mercury out of our system. Mercury itself is neurotoxin, so it is more toxic than lead. So that's why this was some of the consideration where a lot of countries in Europe already banned the amalgam filling. If there is any indication of amalgam removal, like I mentioned before, because of allergies or because the filling is already cracked, the amalgam need to be removed safely. Other than that, it is personal choice to have either keep it or remove it based on your research and what your conviction are regarding this mercury filling. Now, if you do that, if you want to remove the amalgam, make sure that the removal done safely as guideline by organizations such as IABDM and IAOMT. In this guideline, there will be protection not only for the patients, but also for the practitioners and the assistants, and also the environment. Why is it important to keep it safe? Because during the removal, this is actually where the mercury is released the most. So we want to make sure that the vapor is not being inhaled, or the splatter that ingested by patients. That's why we have to do it safely. Also, the mercury, if it's not being taken care of safely, it can release to the environment and can be one of the contributing factor of pollution of our sewer system. In addition to what the practitioners can do to help to remove the amalgam safely, there are things that patient can do as well to help the speed up of detoxification of this mercury inside the body, namely using glutathione and milk thistle, which are the antioxidant that can bind to the amalgam or to this mercury and release out, to our excretion system. Also, you can do lifestyle changes to ensure that you remove it safely from your body. For instance, by having good diet that high in fiber and whole food. Also, avoid drinking alcohol and tobacco smoking or chewing, and especially chewing gum. Because as you chew, it's also releasing this mercury microdosage out. Also, when you have amalgam filling, make sure when you go to dentist not to polish that amalgam, because that's when the mercury also release out. So these are the things that can help you to speed up the removal of micro dosage of mercury inside your body. If you have any question, don't hesitate to call us at 610-664-1641, or you can reach us at presidentialdentalcare.com. Look forward to talk to you later. Thank you.